Family Welfare, Government of India, Dr. V.K. Paul, Honorable Member Niti Aayog, Government of India, Dr. Rajiv Behel, Secretary, Department of Health Research and Director General of Indian Council for Medical Research, senior officials of Troika from Indonesia and Brazil, distinguished colleagues, delegates, invitees of India's G20 Second Health Working Group, ladies and gentlemen, very warm greetings to all of you. It's a matter of joy for India to welcome all of you to the Second Health Working Group meeting in this lovely state of Goa, a popular tourist destination in India and overseas. Goa is known for its exquisite food, culture, heritage and scenic beauty. I hope you have a pleasant stay here and are able to take wonderful memories back home with you. Colleagues, COVID-19 pandemic is a once-in-a-century crisis that had significant repercussions on health, society, and economy, cutting across geographical limitations and territorial boundaries. We can only avoid and manage future health emergencies and pandemics if we invest in our health systems substantially more than we had invested in the past, particularly through the One Health approach. We need to focus on reducing the drivers of pandemic risks to prevent them before they emerge. We must also be working towards containment and control, including availability of vaccines and therapeutics. While all aspects of pandemic PPR are important, prevention usually is under-financed relative to preparedness and response. Towards this end, we welcome the first call for proposals by Pandemic Fund focused on surveillance, lab systems, and strengthening public health workforce. Excellencies, ongoing discussions in multiple platforms such as G7, G20, WHO's IHR reforms, sustainable financing or INB, World Bank's Pandemic Fund, BRICS, AU, EU, UNGA and other international organizations on strengthening the national health systems and the global health architecture are all aligned towards a common goal. Hence, there is a need for effective convergence of these initiatives. G20 member states should work towards interweaving of these initiatives for creating an agile, fit for purpose, health emergencies, prevention, preparedness and response global architecture. I am sure that the Second Health Working Group meeting over the next 2 days will enable all of us to forge global partnerships on pertinent facets of global health architecture, including creating pandemic resilient health systems, plugging the gap of inequitable access to medical countermeasures, augmented with health interventions to ensure last mile delivery. India's G20 presidency has collaborated with WHO and circulated adequately in advance 3 non-papers across all health priorities to supplement our ongoing discussions for an effective convergence and consensus among G20 countries and relevant stakeholders. Excellencies, a side event on digital health is also being organized from 18th to 19th of April, wherein detailed discussions would be held on how digital health can accelerate universal health coverage through creation of a digital health ecosystem, through innovations in healthcare, through technology-driven continuum of care, and through creation of digital public goods. Please grace us with your active participation along with enriching discussion supported by a galaxy of domain knowledge experts who would be part of this side event. Colleagues, we have curated exhibitions for the main event and the side event, and your visit to these exhibition stalls is most welcome. We have some interesting activities planned for our delegates, including a carnival-themed dinner in Fort Aguada, besides a showcase of the vast and varied cultural milieu of India, including Goa. I look forward to very productive, very meaningful deliberations during the second Health Working Group meeting. I thank you all and wish us all well. Thank you.
Thank you, sir, for your opening remarks. Thank you, sir, and for opening remarks and specifically highlighting the guiding framework of India's G20 presidency. Excellencies, we are also joined here by Shri Nayak, Honorable Ministers of State for Tourism and Ports, Shipping and Waterways, Government of India. I take this opportunity to request Honorable Minister of State for Tourism and Ports, Shipping and Waterways, Government of India, to deliver his special address. Sir, the floor is yours, please, sir.
Namaskar. Good morning to all. Dr. Bharti Pawarji, Honorable MOS Health and Family Welfare, distinguished my colleagues and delegates of the second G20 Health Working Group. Being a native of Goa, myself, and as a Minister of Tourism on behalf of the people of Goa, I welcome you all to G20's second Health Working Group meeting. Goa is popularly known as a tourist paradise and confluence of the Indo-Portugal culture with its spectacular scenic beauty, culinary delights, and the tranquility of Goa will be a soulful experience to all of you to rejuvenate your mind and body. While Goa is a great tourist place, it is also promotes the spirituality and traditional Ayurveda. I would therefore recommend the delegates to experience holistic traditional and Ayurveda therapies here in Goa. Colleagues, I would like to emphasize the age-old Indian philosophy of Atiti Devo Bhava, which means guest is God. This guiding principle reflects the spirit of hospitality deep ingrained in the Indian culture, where the guests are treated with utmost respect, care, and warmth. As we delve into the second Health Working Group, it is important to highlight the significant strides made by the Ministry of Tourism, Government of India in recent years, especially the aspect of health and wellness tourism. Allow me to share some fascinating data that reflects the remarkable progress of Indian health tourism. In the past 4 years, more than 1.8 million foreigners visited India for medical treatment, making it one of the top destinations for medical tourism. In 2021, the country ranked 10th in the world in the Medical Tourism Index compiled by the Medical Tourism Association. India boasts almost 600 globally and nationally accredited hospitals that provides the world-class treatment. India's ancient system of medicine have gained a global recognition for their holistic approach to health and well-being. I have been informed by my colleague at the Ministry of Health and Family Welfare that a yoga session has been planned for all the delegates tomorrow morning. I request and encourage everyone to participate for their powerful impact on physical, mental, and emotional well-being. The Ministry of Tourism has been actively promoting this traditional system of medicine along with the other wellness practices to attract the health-conscious travelers from around the globe. Furthermore, in the wake of the ongoing global pandemic, health and safety have become the paramount in the health tourism industry. The Ministry of Tourism has been taking measures to ensure the health of tourists, including implementing the standardized protocol for the hygiene and sanitation across the various tourism facilities and services. These measures not only ensure the well-being of the travelers, but also boost the confidence in India as a safe and responsible tourism destination. As we gather here today, it is crucial to recognize the immense potential of tourism in promoting the health and wellness and its positive impact on the physical, mental, and emotional well-being of travelers. By promoting health and wellness tourism, we can collectively contribute to a more holistic and sustainable approach towards global health. I'm excited to hear from our esteemed speaker and participant as we engage in meaningful discussion on the various aspects of the global health architecture. I urge all of you to actively participate, exchange the ideas and explore where to unleash the full potential of this forum. Once again, I warm welcome to all of you. Thank you very much.
Thank you, sir, for your warm welcome and highlighting the theoretical underpinning that is Atithi Devo Bhava, which is vested into India's philosophy, where we treat God, the guest, as akin to God. Dear friends, we are also delighted to be joined by Dr. Bharti Praveen Pawar, Honorable Minister of State for Ministry of Health and Family Welfare, Government of India. I take this opportunity to invite Dr. Bharti Praveen Pawar, Honorable Minister of State for Health and Family Welfare, to deliver the inaugural address.
Namaste. A very good morning to all of you. Excellency Shri Shripad Naik Ji, Honorable Minister of State, Tourism and Ports, Shipping and Waterways, Government of India. Professor V.K. Paul sir, Member Niti Aayog. Shri Rajesh Bhushan Ji, Secretary, Ministry of Health and Family Welfare, Government of India. Dr. Rajiv Bahel Ji, DG ICMR and Secretary, DHR, Government of India. Shri Love Agrawal Ji, Additional Secretary, Ministry of Health and Family Welfare, Government of India, also the focal point for India G20 Presidency Health Track. Distinguished colleagues and delegates of the second G20 Health Working Group. Friends, at the outset, I take this opportunity to thank you all for joining us for the second Health Working Group meeting in Goa. As told by Honorable Minister Shripad Naik Ji, Goa is known for its World Heritage Architecture, rich heritage, and world-class beaches. I look forward for your comfortable stay here, infused with flavors of Goan culture and the diversity of India. Friends, India G20 priorities focus on reform multilateralism that creates an accountable, inclusive, equitable, and representative forum fit for addressing the many challenges in the 21st century. Our Honorable Prime Minister Shri Narendra Modi ji envisions the world to be one extended family. We are guided by the principles of Vasudhaiva Kutumbakam, enshrined in our Upanishads. Over the years, G20 has contributed immensely in addressing several global issues and resolving the complex problems encountered by the world. As I say this, I would also like to acknowledge and appreciate the role and contribution that the G20 Health Working Group has played since its inception in 2017. Friends, I'm happy to highlight that during the first Health Working Group meeting in Thiruvananthapuram, that is in Kerala, delegates from G20 member states, invited countries, and international organizations broadly align with India's G20 proposed health priorities. We have taken into consideration all the points brought forward by the delegates during the first meeting and have provided additional inputs in that direction through the circulated non-papers and issue notes for the second Health Working Group meeting. Friends, there is a need to leverage the momentum of the ongoing discussions in global health field and focus on critical aspects such as collaborative surveillance, community protection, safe and scalable care, access to medical countermeasures, and emergency coordination, and in turn work towards having a clearly defined and comprehensive fit-for-purpose global health architecture. India's G20 presidency proposed health priorities are supported by the morals of the whole world is one family and of universal brotherhood, and is therefore striving to converge ongoing initiatives towards building resilient healthcare delivery system supplemented with equitable access to vaccines, diagnostics and therapeutics, and use of technologies across the health services spectrum to ensure that no one is left behind. Friends, much as we may wish, we cannot be sure of when the next health emergency may hit us. It may not wait for the conclusion of the INB process or IHR reforms. While multiple of challenges related with health emergency management need to be addressed, I am hopeful that the deliberations over the next 2 days will create consensus on developing a minimum viable product duly following the lowest common denominator approach for managing future health emergencies and network of R&D and manufacturing for vaccines, therapeutics and diagnostic, that's VTDs, besides the global medical countermeasures coordination platform. As highlighted by Honorable Prime Minister Narendra Modi ji during the recent Foreign Ministers meeting, India's G20 presidency theme of One Earth, One Family, One Future signifies not only the need for unity of purpose, but also the unity of action. India's philosophy of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, which means that let everyone be happy and enjoy good health, underpins the concept of one health implying let all beings be happy and remain free from suffering. We need to work collectively towards a happier and healthier world. With these words, I declare the second Health Working Group meeting open. Thank you so much.
Thank you, ma'am, for setting the tone for today's meeting and for your thought-provoking address. Now we may have the curtain raiser video for the second Health Working Group meeting.
India welcomes all G20 delegates for the second Health Working Group meeting to Goa. The land of fun and togetherness. The land of happiness. But can there be happiness without good health? Absolutely not. After a period of immense learning and understanding, the world has recognized the significance of global cooperation and integrated actions for the good health of people. Following the success of the first meeting in Kerala, the G20 Health Working Group has an incredible opportunity to converge efforts, translate intent to action for the creation of a resilient, responsive, and robust global health architecture. The pandemic has shown that the world is vulnerable. The Health Working Group agreed to converge various discussions and efforts to compose a cross-sectoral, multidisciplinary, and multi-stakeholder ecosystem for pandemic prevention, preparedness, and response. As a group, we must synergize global efforts to build core public health capacities, early warning and surveillance systems, countermeasures, and research to bolster pandemic preparedness. The working group agreed to work together to strengthen the pharmaceutical sector, to ensure accessibility and availability of safe, effective, and affordable medical countermeasures. And now, we look forward to working as one to establish a framework for an end-to-end global medical countermeasures coordination platform to facilitate new and existing R&D and manufacturing networks to ensure life-saving vaccines, therapeutics, and diagnostics for all. To overcome gaps in health service delivery and reach the last mile, there is a need to leverage cutting-edge technologies and ensure that digital health tools are freely available. The working group welcomed the proposal for a global initiative that will converge and bring together existing initiatives from across the world and focus on curation of new digital tools to improve health service delivery, especially in lower and middle-income countries. The initiative will help scale digital health innovations and solutions across the world, maintain interoperability standards while conserving data security and privacy of the patients. There has never been more opportune time for the world to come together as one, converge and consolidate ongoing efforts to build a resilient, responsive, and robust global health architecture. Let us join hands to create a healthier future for all. G20 India. One Earth, one family, one future.
Now, I would like to invite our Troika members for their opening remarks. I request that the opening remarks may preferably be limited to 5 minutes each. We would now request our colleagues Ramli from Indonesia to take the floor, please.
Thank you, Chair. Honorable Dr. Bharati Pravin Pawar, Union Minister, Ministry of Health and Family Welfare, Government India. Honorable Mr. Siripat Naik, Union Minister of State, Ministry of Tourism and Ports, Government of India. Honorable Mr. Rajesh Bhushan, Secretary of Ministry of Health and Family Welfare, Government of India. Distinguished delegates, on behalf of the delegation of the Republic of Indonesia and as a member of the